organ transplantation. Because of advances in organ and tissue transplantation, this man, named Richard, after a terrible incident, desperately needed and got a face transplant. This is Richard after surgery. His transplant included not only face, but upper and lower jaw, teeth, tongue, and scalp with hair. This is Richard after his successful transplant. The need for organ and tissue transplants increases each year, and many of your clients are pre- or post-transplant. Your knowledge and application of concepts related to this patient population can truly make a difference in their lives. Hello, this is Eva Feldman, graduate nursing student, with your lesson on organ transplantation. Here's what we'll cover in 4 sections: an overview, recipient selection, donor selection, considerations before, during, and after surgery, immunosuppressive therapy, and complications. The first 3 sections include a Kahoot game. Don't worry, the game scores don't count toward your grade. Relax. They're just for fun and review. You will get to complete your question of the week after the 4th section. Professor Moody will let you know more about that. This recent data from the United Network for Organ Sharing, or UNOS, shows how transplants along with donations are increasing. However, the need for organs still outnumbers the supply. Let's talk about the recipient selection process. First, why do people end up needing an organ transplant? What are the indications for an organ transplant? If you think about which conditions and medical problems make major organs fail, then you know what leads up to it. But the main reason or indication for an organ transplant is end-stage organ disease. If a living donor is involved, however, the transplant can be performed before the organ damage gets too far. Let's look at some organ-specific indications for transplantation. Why do people end up needing a kidney or liver transplant? Some common causes, as you may know, for kidney failure are hypertension and diabetes. Your patient with hypertension or diabetes or both could end up needing a kidney transplant. It's really important to teach your patients to keep their blood pressure and glucose within normal limits, and why. When disease in the liver is irreversible, that's an indication for a liver transplant. There are others, but some causes are hepatitis, primary liver cancer, or alcoholic cirrhosis. Why do people end up needing a pancreas transplant? You probably guessed diabetes is the major reason, especially if they also need a kidney transplant. Some people can't tell when their blood sugar drops. It's dangerous, and it's called hypoglycemic unawareness, so they may also need a pancreas transplant. Causes of end-stage heart failure include ischemic and idiopathic cardiomyopathy, valvular disease, and congenital problems. What about lungs? COPD is an indication for lung transplant, and common causes are listed here. This is important. For a lung transplant, the client can't be too sick or they won't survive, or too healthy or they may not qualify for a transplant. During the process of selecting a transplant candidate, multiple factors have to be considered, factors that can make the transplant successful or unsuccessful. First, let's look at medical factors. Things like, are there newly diagnosed medical problems? If so, can these be successfully treated? Biologic age is another factor. As older patients, the text says over 55, have a higher risk for complications. Infections, acute and chronic, should be absent, or the treatment should be completed before this process goes through. It's best if inflammatory diseases like systemic lupus, erythematosus are in remission, as they can also complicate the transplant process. Here are some psychosocial considerations. This is important. A psychosocial assessment is done on all transplant candidates. There's a lot of psychosocial factors. Is the client motivated? Can they understand and follow instructions? Can they follow through with all the required diagnostic tests and the vigorous medication regimen? If there's a history of psychiatric issues, can the client give informed consent? Can they adhere to the medical regimen? A lot of things to think about. To give you an idea of what is assessed, here are some categories from one of the pre-transplant assessments. It's called the Psychosocial Assessment of Candidates for Transplant. Here's an example of the cost involved for a kidney transplant. Your textbook has another example. You can see the financial aspect to everyone involved in transplantation is significant. Now that we've looked at some factors to consider, let's talk about some pre-transplant diagnostic and evaluations needed. There are many. ABO typing, tissue typing or histocompatibility testing, human leukocyte antigen or HLA matching, mixed leukocyte matching, and transfusion history, but that's not all. Infectious disease screening for all of these infectious diseases is needed. Remember, if there's an acute or chronic infection, treatment should be completed in preparation for organ transplants. The text does mention an exception, though, for a localized liver infection. Other blood work, like liver and renal function tests, blood count, coagulation studies are also needed. Probably electrolytes too, right? And evaluations like GI, GYN, dental, EKG, chest x-ray. Plus, there's even more organ-specific testing that's likely needed. Now you can start to understand how lengthy and taxing this process can be, and what it means for people waiting for transplants to be ready. These tests are not just done once. They have to be done regularly to maintain patient readiness. Let's move on to donor selection and talk about compatibility. There are two major antigen systems, and they must be compatible. ABO is a primary one. You already know about the blood types. It's the same concept for organ transplants as for blood transfusions. Type A blood has the A antigen and so on. Histocompatibility testing or tissue typing means identifying antigens in the donor and in the recipient. And once they're identified, you have to see which antigens in the donor that the recipient has antibodies against. Identifying antigens like that is how compatibility is measured. It predicts the chance of graft acceptance by the recipient's immune system, which is programmed to tell self from non-self. The higher number of matching antigens means a higher chance of graft acceptance. Nobody has a perfect match. That's a given, so you still have to suppress the immune system. This is important. Histocompatibility testing predicts the chance of graft acceptance. In any discussion about organ transplant, it's really important to talk about living donors. Even though transplants are increasing, there's still a shortage of organ supply compared to the demand, and living donors help fill that need. The most organs from live donors are kidneys. The left kidney is preferred. The left renal vein is a little bit longer than the right usually. For a liver transplant, they use a portion of the liver from the living donor. The liver is special, and it's really important because the liver can regenerate. That's an important concept there. The liver can regenerate itself. Pancreas transplants from living donors are rare. And then as far as lung transplant, if a child needs a lung transplant and there's not a cadaveric donor available, sometimes they use one lobe of the parent's lung or one lobe from each parent for the child. Moving on to deceased donors or cadaveric donors, organs are procured in Maryland by the Living Legacy Foundation. It's called an OPO, an Organ Procurement Organization. And the Living Legacy Foundation covers most Maryland counties except for the ones named above. Hospitals are required to refer brain dead clients to Living Legacy Foundation of Maryland. What they use is called a first person authorization, and that means if a brain dead client is a registered donor, and that's through the state registry, through your driver's license. If they are a registered donor, the LLF has a legal obligation. They have to follow through on the deceased donor's wishes, in which case they just let the family know that this is what your loved one wished, and we're going to follow through with that. If not, if they're not a registered donor, then the family decides. Just think about, did you have any clinical experience with this? Did you observe a nurse in one of the units having to call the Living Legacy Foundation? Now, that was at the state level, so we'll talk about the national level now. This is important. UNOS, or the United Network for Organ Sharing, is a national agency that determines organ allocation and manages organ transplants in the U.S. UNOS controls the organ waiting list. It manages the database, that's mandatory reporting, and it's involved with policymaking and education for the public and for professionals. In this last section, we'll talk about determination of death for the cadaveric donor. This is something that you had in your neuro unit, so this should be a little bit of a review for you. Death, as you know, is determined by the absence of cardiovascular and brain function, and they test reflexes to see if they're present or absent to determine this. As you know, they test motor movement, pupil responses, and the reflexes listed up there along with apnea testing. Pediatric criteria, it's different from the adult criteria because the immature brain is more viable. As the nurse, you really should be familiar with relevant laws and your facility policies. And it's important to keep brain death conversations separate from organ donation conversations. There's an organ donation coordinator that will be talking to the family. Your role as a nurse includes identifying potential donors, being the patient's advocate, following their donation wishes, supporting the family, and working with the donation coordinator on physiological support for the patient. Are you ready for Kahoot? My grandson Hunter is. See the directions below in the video description. I hope you've enjoyed this lesson. Thanks for listening.